Hello, lovely people of the world.
Magandang araw sa inyo lahat.
안녕하세요, 여러분.
Ahlan wa sahlan.
This is Justin and Sarah. In today's video, we'll talk about week 28, 29, and week 30 pregnancy update. Take it away.
Alright, so first of all, I'm gonna start off with how far along I am. Today is November 8th. And today I am actually 30 weeks and 6 days along. Symptoms. I'm really getting more tired lately, and I could actually sleep for longer periods now. So I could sleep, say, for 8 hours, wake up, and then an hour later feel like sleeping again. Oh my gosh, I feel so lazy. I'm eating a lot. I would say every 2 hours I get hungry, so yeah. Poor Justin here. It's like, honey, let's eat this. You're like, what? We just ate, but okay. I guess people are asking whether you gained weight. Did you gain weight?
Only because I'm always eating whenever you're eating. Even though I'm not hungry, I don't want to make her eat by herself and feel lonely, so I eat with her. So I think I'm gaining weight.
Isn't he the sweetest? I'm starting to feel pain to my right wrist. So it started here, right below my thumb, and it's still there. It's starting to spread a little bit down here now. But that's as far as it goes. It doesn't go all the way around or anything like that. So yeah, I started asking my sister, my pregnant friends, my previously pregnant friends, I'm like, is that normal for you? And they were like, yeah, they say it was fluid retention or increased blood volume that's pinching a nerve there, and that it could lead to carpal tunnel. And I'm like, oh, carpal tunnel, no. If you guys watch our previous video, my sister and I talking about symptoms during pregnancy, that's one of underestimated symptoms during pregnancy. It's not mentioned as frequently as it should. It's a pinched nerve that causes numbness, tingling, and pain in some cases. In my case, it's pain. Pumpkin convinced me to buy a tensor support for my right wrist. As soon as I told him about the pain, he was like, let's not wait till it gets worse. Let's buy it today. I'm like, okay, fine. So we went and bought it at the nearest supermarket. It's just a little brace or splint or immobilizer that goes down here. It's really cute though. Next question, total weight gain. For week 28, I tipped the scales at 131.4 pounds, which is a 0.2 pound weight gain from week 27. And then at week 29, I tipped the scales at 132.4 pounds, which is a 1 pound weight gain. And finally for week 30, I tipped the scales at 134.2 pounds, which is a total weekly weight gain of 1.8 from last week. And when you total entire pregnancy, I have a total weight gain of 22.2 pounds. Some people say that the first baby is usually smaller than other, like the second or third babies and whatnot. So yeah, I was hoping that this first pregnancy I would only gain the minimum weight gain, recommended weight gain, which is 25 pounds. But looks like at week 30, if I'm already at 22 pounds, I'm most likely going to hit the 30-pound total weight gain mark for this entire pregnancy, which is fine. As long as baby girl is growing nice and healthy, and you know, as long as all that weight gain is for her, then I'm more than happy. Go for it. Am I wearing maternity clothes? I am starting to stick to maternity leggings now. I only have 2 pairs, both in black. But I noticed that on a nicer day, I could actually get away with my regular leggings. And then the tops, I haven't been wearing maternity tops. Just the Bedura tank top really is the only maternity top that I own. Everything else is like my usual top. So my usual, just really stretchy tops, which is really comfy. The only catch is I noticed if I didn't wear maternity leggings, then I don't have that extra layer that goes up here, which does not cover my belly button. And any skin issues? Nope. I did not notice any stretch marks yet, but my belly is getting itchy.
There are a lot of red bumps on your belly.
Only after I sort of mini poke. So whenever I feel an itch in my belly, instead of scratching or rubbing, well, I try rubbing. I rub and then I also do like a fingernail poke. I have very short fingernails, you guys, though. So a fingernail poke just to help with the itch, and then I'm done.
I keep telling her not to poke her belly with her nails because her nails are sharp.
They're not. Look at them. Look at them.
And it's causing all those red raised bumps.
But it goes away.
It doesn't go away.
Goes away. And I'm starting to lotion up. It's just not every day. Next question. Highlights for the week. Do you remember, I don't know if you guys watched our previous video, but our previous pregnancy update for weeks 25 to 27, I had mentioned the glucose tolerance test, and on week 28 I had my OB appointment, which is a follow-up on the glucose test. And you know how I said that, oh my goodness, for sure I'm gonna fail this second glucose test? Well, I passed. I passed. I couldn't believe I passed. I was like, are you sure? Are you positive? Because I was so ready to fail the second one. But yeah, this is the one where you fast at least 8 hours prior. So my OB was like, good news, you passed your glucose test. So I was happy to hear I passed. I was like, oh, thank goodness. And then that's when I asked my OB for a bunch of questions. Hang on. My OB started talking to me about the flu shot, that she would highly recommend that I take the flu shot. And also the Pertussis shot, or the whooping cough shot, which is vaccination really. I expressed my fears about the flu shot. I mean, I'm not against other people who take it. I'm good for them. But I told her about how I've only ever had the flu shot once in my entire stay in Canada of 9 years. And that one time I took it, I experienced a bad side effect, which is flu-like symptoms for a month and a half. And I've never been that sick, that weak, that bedridden for so long. So I told her that, you know, that was my fear, was that I might react the same way, and I just don't have any more sick days. I know she was telling me about, it's good to pass the antibodies on to your baby and all that. But then I asked my sister, did you take the flu shot when you were pregnant with your baby? And she's like, no. And I asked my mom, and of course my mom, she raised all of us in Dubai, so she's like, what flu shot? There's no such thing as flu shot back there. What are you talking about? It's hot and tropical there. So I expressed my fears to my OB, and I was like, would it really harm my baby or be risky for my baby if she were to come out of me and not have antibodies against the flu? And she was like, no, actually it's not even a guarantee that the flu shot will protect you. It's just we're hoping that it's the right strain. And I'm like, okay, cool. So is it okay if I do without it? And she's like, yeah, by all means. It's just, it's my job to recommend it. So I'm like, okay, cool. Thank you. And then she was like, okay. And for the whooping cough vaccination. So I told her that I'm pretty sure I had this vaccination when I was born, and as well as in adulthood about 4 years ago when I had to go for my nursing practicum. And then she was like, you need to take it one more time during this pregnancy in your 3rd trimester, because that's a new guideline we've had in our Society of Obstetrics or whatnot. It's a new guideline that came out this year alone. That's why my sister did not have it. And then she measured my fundic height or fundal height, which is basically the height of the uterus. She's like, yeah, your baby's actually measuring slightly larger. So it looks like your baby's a bit like a week in advance in height, but that's just a fundic height. So that's just the height of, like, the length of the uterus. So they don't know for sure whether it's the baby or it's just the uterus is expanding more that way. But they're like, yeah, but don't worry about it. We're going to book another ultrasound just to make sure everything's okay, that your fibroid looks okay and everything. So I was like, yay! She also mentioned whether I'm changing anything about my diet or whether I'm still taking my prenatals, and I told her I am. And she's like, because your blood work came back that your iron levels are dropping. Your iron level was 48, and then now it dropped to 24, so it dropped to half. So she's telling me, you know, like, are you vegetarian? I said, no. She's like, okay, try to eat lots and lots of red meat, lots of beef, and also up your green leaf vegetable intake. And I'm like, oh, that's probably it. In my head, of course, I didn't tell her out loud, but in my head I was like, pumpkin hasn't been making me smoothies. That's probably the difference. But my sister reassured me that that could not have been it. She was like, well, her doctor told her during her pregnancy in her last trimester that the baby is actually using up more of nutrients in your blood, the maternal blood, which is why it's dropping.
In my defense, the reason why I stopped making smoothie because you won't take them anymore.
I did at some point got tired of having to drink a smoothie almost every day during my first and second trimester. So I was like, you know, I haven't been drinking them fast enough and they were starting to go bad. So yeah, okay, fine. You get a hall pass. But honey, I promise now, for the baby's sake, that I would drink them. I promise. So after this OB appointment, I called the community health center line, and then they were telling me that I already received my whooping cough or pertussis vaccination back in 2014, and that I don't need it because it's supposed to last me for 10 years. So my next vaccination for that is in year 2024. So they were telling me to go back to my OB and tell my OB that. And I was like, I'm pretty sure she knows, and she said it's a new guideline that came out that I should get it during pregnancy. And then they were like putting up a fight on the other end of the phone. They're like, no such thing. What guideline is she looking at? Is she looking at American guidelines? Because we're in Canada. And I'm like, damn, this person's got attitude. So I was like, okay, that's what I'm gonna tell her then. That was my highlight for week 28. Week 29, nothing much happened. So that was easy. And then my highlight for week 30 is... So in my week 30 appointment with my OB yesterday, I discussed with her about my fears of the whooping cough. Because actually I read an article. I know you guys might think I'm so naive and so dumb or whatever, but that's what I did was I went online, checked out Dr. Google.
And believe everything you read on Google.
I believe everything I read. But there was one article, just one article, that had two moms claim that the whooping cough vaccine actually, like they could swear that that's what caused it, actually sent them into preterm labor, because what happened was their baby was starting to move less. They were just like really mad at their doctors for suggesting that they are recommending that they have the whooping cough vaccine. So yeah, I talked to my OB about that. I'm like, okay, you might think I'm really silly, but I read this article and I just need reassurance from you that nothing bad's gonna happen. And she was like, listen, I'm your doctor. I'm a baby doctor. I make sure that if anything seems iffy or is not part of our Canadian guidelines of obstetrics, I would never recommend it to my patients. And I'm telling you, it's completely safe. I've helped deliver babies of moms who have had the whooping cough vaccine during their 3rd trimester, and everything went well. They all reached full term. You know, like there was no issues. She is insisting that it's possible that the two moms in the article happen to not know that there are other predisposing factors that led to their preterm delivery and all that stuff. So it's like, okay. So she reassured me and I'm like, okay, I'm gonna get it. But it's not covered by public health anymore because I've had one shot already during my adulthood before my nursing practicum. So I need to pay $50 at the pharmacy with the doctor's prescription for the vaccination. And then I would have to pay another $20 on top of that for the pharmacist to administer it to me intramuscularly. And I was like,
you can get all that reimbursed.
The whole reimbursement process is just a long process.
It's not long, it's very simple. I do it all the time.
This is what got me teary-eyed, you guys. She said that the baby's head is down. So I was like, oh my gosh. I felt so emotional that day in the clinic. On my drive home from the OB clinic, I started getting teary-eyed and look what's going on, what's wrong with me? It's so strange. It's just an overwhelming sense of joy knowing that baby's head is down already. I mean, it's only 30 weeks. From her experience, the baby's most likely only gonna twist side to side, like turn side to side. But if the head is down, the head stays down because there's not much room for baby to be swimming around in order to perform a flip. So yeah, she was like, yeah, baby's most likely gonna stay head down. So that's reassuring. But then the one thing that was worrisome for me was that the doctor, our OB, mentioned to me about how she's gonna have to schedule another ultrasound when I'm like 32 or 34 weeks along. And for this ultrasound, they're going to check the size of baby and also the fibroids, the location, and all that stuff. Because she said that I have a marginal cord insertion, and I'm like, I'm sorry, what? What's that? So she's like, a marginal cord is like the umbilical cord of baby is attached to the placenta at the side of the placenta as opposed to the center. Meaning it's possible that baby's getting less nutrients from me, which is really worrisome. I was like, what do you mean? I've been eating all this time, I've been drinking all this time, I'm having all my prenatals and vitamins and staying on top of everything, and you're telling me now that it's possible my baby this entire time was not getting enough nutrients? She's like, typically results in the baby having a low birth weight. And she's like, but don't worry about it. You know, like even if they're low birth weight inside of you, they come out and then they grow into a healthy weight, healthy size, healthy height, healthy everything. So don't worry about it. I've seen so many pregnancies, successful pregnancies and delivery, and baby's just fine. We just want to make sure the baby is at the right size. So I'm like, okay, cool. This little girl's really special, isn't she? Yes, she is. I mean, that's just the way my uterus is made, I guess. And I have conceived baby girl at age 31. I am me? 31. I'm like trying to remember. 30, 31. Yeah,
I'm trying. Something you want to tell me?
Oh my God. That could possibly be why there's all these mini complications here and there, but I'm trying not to worry. Oh, one more thing. So my wedding rings are starting to feel tight around my ring finger. So I just wear it around my neck, which I don't have it right now. Do my fingers look swollen?
I think they look a little bit swollen.
Which is good. Slow swelling is good. They said it's alarming or an emergency if you start to find like sudden swelling. Any vivid dreams? I just remember waking up from 2 of them really mad at Justin.
Again.
My poor husband. I was starting to sense he had another woman. That's one dream. But I never actually caught him in my dream. I just remember waking up really pissed. And then the second vivid dream I had was I was yelling at him and he was yelling back, and I'm like, I know you didn't just answer me back, dude. You know, I'm pregnant, but at least in my dreams, I'm recognizing I'm pregnant. I woke up the next day, he was trying to be all cuddles, and I'm like, get off of me. Don't talk to me right now. There's sometimes when he would text me in the morning and I would delay it a little because I'm like, don't want to talk to you right now. I'm still mad from that dream. And I don't tell him about it until
so
later.
That's why you're not responding to my text.
I could also be busy at work, darling.
Okay, no more smoothies for you.
Oh, baby. Next, any cravings or aversion? I've been craving hot chocolate lately, whether it's white or dark or milk. Hot chocolate. What else? Aversions. I've developed a slight aversion to beef. Anything making me queasy or sick? Nope, 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 nope. Am I happy or moody most of the time? Am I happy or moody, honey?
She's so happy all the time.
Yep, I paid him to say that. Anywho, what am I looking forward to? Our next ultrasound. What are you looking forward to?
The baby.
He's hoping baby comes out. It's like, should be safe now, right? Should be safe. Oh, is my belly button in or out? Well, my sister says it's kind of out. Yeah, kinda. But she's insisting it'll come out like a finger. Yep, so I could actually feel baby move more, doing a twirl, almost like a flip if you ask me. Kind of sticking a limb out against my belly every once in a while. I don't actually feel the kicks as much. So yeah, I could actually feel more squirms and twirls as part of baby's movement than I do feel her kicks. A lot has happened week 30 actually. So Justin and I were able to pick new sofas and got them delivered. Maybe we'll give you guys a bit of a house tour one day. Well, it's all tarped up. How about you explain that part?
It's all covered up.
So the guys came in from the Brick. That's the furniture store we bought the sofas from. They set it up. They unboxed it. It was perfect. We kind of sat and enjoyed it for like
2 minutes.
2 minutes. And they're like, okay, that's it. And Justin decided we're gonna have to tarp them up.
Because we have 2 cats who love to scratch furniture.
Well, I think they love to scratch leather, which we didn't buy. We did not buy leather sofas this time.
Our sectional is micro sway, and our power recliner is full sway.
Anyway, you guys get to see it one day, I promise, because we are planning a baby shower at our home next month. Tune in for that. So another highlight for week 30 was...
So we bought a Hello Bassinet.
It's a bassinet, or an infant bed, that we had purchased off of Kijiji.
Classified ads.
And you know what? It doesn't make sense for us to buy a brand new bassinet if it's only going to last our baby about 3 or 4 months of her life. So we're like, yeah, let's just buy it used. I mean, we'll make sure everything's all washed and disinfected and stuff. And it's such a bargain as well, because normally if you purchase that in store, it would cost us about, what, $300? But he got it for...
150.
Half price! guys! Woot woot!
Thanks for watching, you guys, and remember to like, comment, share, and subscribe. There we go.
Thanks, you guys, for all your wonderful comments, and we look forward to hearing from you guys again. We love you. Bye. Mwah.
Bye.